if it's not pain, it's not cancer. But I would say that 90% of breast lump are not painful.
If there is a lump and it's not painful, don't disregard it. It's important to actually get it checked. Hi everyone, and welcome to this special episode brought to you by Income Insurance in partnership with the Breast Cancer Foundation. I'm Natalie, a financial consultant with Income and also your host for today's conversation. Income Insurance has proudly been the presenting sponsor of the Pink Ribbon Walk for 3 consecutive years since 2023. It's a cause that's very close to our hearts, raising awareness about breast cancer and showing support for those affected. This podcast is another way we are continuing that conversation, and we're so glad that you're here with us today. Today, I'm specially joined by Dr. Choo Bok Ai, and we'll be talking about breast health, early detection, and how each of us can play a part in making a difference. Welcome to this podcast, Dr. Choo.
Thank you for inviting me. Thank you.
Yay! So maybe let's just start off. How are you today? How are you feeling?
Great. I feel great today. Because every day we're supposed to feel great. We must be happy that we are alive and well.
Indeed. Oh my gosh, preach. Wow, that's awesome. How about you share a little bit about yourself?
So I'm trained as a clinical oncologist. So I graduated from the UK. Then I come to Singapore to work as a consultant. I was in public hospital before, but now in private practices. So I work as a radiation oncologist. I give radiotherapy for cancer.
Oh, radiotherapy. How many years have you been in this occupation?
So total 24 years.
24 years. Yes. Wow, 24 years of his life dedicated to the study and research and the treatment of breast cancer related. Has it always been breast cancer related?
I treat all sorts of cancer, but breast cancer is the number 1 cancer in the world now, and in Singapore as well.
In the world?
Yeah, it's in the world. So actually it's superseded lung cancer as the most common cancer now. So breast cancer is on the rise now.
Oh my gosh, wow. Okay, so that's actually a fact that I think not many of us are aware of. Breast cancer is the number 1 cancer in the world right now, and I think maybe you can share a bit about what do you do as a radiology oncologist?
So what I do is that I see new patients diagnosed with cancer. Then I go through the treatment of using radiotherapy, and sometimes I also talk to them about their lifestyle. I talk about their general prevention strategy, and also talk about their recovery process after being diagnosed with cancer.
Wow.
So a lot of times when we treat cancer, you must look at the holistic approach.
Yeah.
So sometimes the patient, when you come to us with cancer, there are a lot of fear, apprehension. They are also not sure who to trust, whether they meet the right doctors or not. So a lot of times we have to spend a lot more time with cancer patient compared to someone who go to a GP, a cough and cold. It's just very easy in and out because you want the medicine and you want an MC. But for them, they really need support. So the support, they look towards you, what advice you can give them to prevent cancer recurrence. They want to know that what the side effect of the treatment that you're going to offer to them. And basically, they are looking for hope.
Hope, definitely, yeah. Because I think I can't imagine the amount of anxiety and stress that a person can feel when they hear that they might have breast cancer. I think just being in this line, you must have seen, can I say thousands of people?
About 7,000.
7,000 people, wow. And maybe can you share a bit about how did you get involved with the Breast Cancer Foundation?
Many years ago, because I graduated from the UK, so in the UK, they are more aware. I mean, cancer is less of a taboo. They like to talk about, especially women, they like to talk about their illnesses.
And they're very open about it there. I see.
So when I come back to Singapore, I found that this open approach or support group is not really materialized. There is some, but it's a taboo to say that I got cancer. Sometimes they hide from their friends, their family,
Yeah.
So for us, if you share it out, more people will listen. But they are very scared of this thing called sympathy. People want empathy, but not sympathy. Empathy means that they want you to understand them. They are going through a process, but they want to sympathize with them. Sympathize in the sense that they pity them. They want to.
That's not the right approach. Yeah, correct.
So listen to me, but don't pity me because you're so sad you got cancer. They don't want this kind of.
That's very It's a very fine line, right?
Fine line, yeah. So what after I usually teach them to say as a caregiver, I say that you are there to support them. You're not there to just give them medical advice. But sometimes a lot of times your neighbor or your friend give you a lot of advice because I heard from this thing. So
unsolicited advice.
So sometimes you say, so a lot of times when I joined Breast Cancer Foundation, one of my first priority is actually to set the medical facts right. So I'm not the president of Breast Cancer Foundation, and then every month we have a breast cancer support group meeting. So I'm there sitting down with them in case there are some myths or some questions that they don't understand, they can ask. But majority as you say, this is a peer-to-peer support. I let them share their stories because cancer survivors encouraging cancer patients who's newly diagnosed to how they walk the journey before. To be honest, I've seen a lot of people with breast cancer, but I've never had breast cancer. So how do I know how to live with breast cancer? I do not know, to be honest.
That's true.
But those cancer survivors who have lived the illnesses, they come here to share the story with you. So I'm there to listen. So in case there's any medical-related questions, I'm there to answer it correctly. My solution is this one may not be the correct solution.
That's true.
So we have a lot of myth and facts separated out. So that when we have a doctor on site or I bring physiotherapy to give a talk as well. So we do exercises there.
Okay.
And then we have recently an orthopedic surgeon talk about bone health, how women with breast cancer who have undergone chemotherapy have higher risk of getting osteoporosis and hormonal treatment. So we look at the holistic approach of their whole life, not just on breast cancer alone, but generally I teach them exercises, talk about nutrition and diet, basically, and also give a lot of mental health support for them.
Yeah, that's so important.
Yeah.
You mentioned myths and I don't know, fake news when it comes to breast cancer. Do you mind sharing some with us? I think maybe it's about time we bust these myths.
So some of the misconception was breast cancer only happens when you're more elderly woman, right? So I think, I mean, the question is that will a 30-year-old get breast cancer?
I think yes. It's possible, right?
It's possible. Now, in the research just recently published this year, they showed that actually under 40 years old, when the mammogram is not indicated, that means there's no screening program for under 40 years old because screening start only at 40 years old.
Oh, I see.
But 10% of the patient with breast cancer diagnosed age under 40.
Oh my god, that's so scary.
Yeah, so the thing that we try to tell them, normal people, female, is to do breast examination starting when you're in the 20s.
In the 20s, you have to start already.
Yeah.
Wow, that's really young.
The youngest I've ever seen was a 19-year-old girl. She's going to go university. Then she said, should I defer university?
Oh my god.
Because I just been diagnosed with breast cancer. So sometimes it does affect. And this patient, they say, could be really related to the genetic, but genetic only related to 10% of that. So 90% of cancer, we do not know the real, risk factors. We know some of it, but a lot of times it can happen to the first person in the family who have
in
cancer.
the whole bloodline. That's the one to get it.
Yeah.
Wow. Okay, that is very shocking. Actually, I really thought it was for those who are older. How is one way that I would say the younger generation, females, how can we start to self-diagnose to check? Is there a way, or must we go through the formal way, like, okay, we go to the doctor, we set up a mammogram?
So no need to do so. A lot of the website and even Breast Cancer Foundation, we actually have a brochure to teach you how to do it. So actually, because it's a self-breast examination, usually when you go to a shower, your skin gets a bit moist, so it's actually easier to feel it. And when you actually feel the breast, when you examine. So I ask them to do it about 14 days after the first period. Because during the first 7 days, it's a bit painful to press because you're having a period at the moment. So about 2 weeks later, after that, you can just self-examination, just once a month. Most of the cancer lump is actually not painful.
Okay.
So one of the myths is that if it's not pain, it's not cancer. But I would say that 90% of breast lump are not painful.
90% not painful?
Not painful.
My gosh. So wow, okay, so for everyone listening, just to repeat what he said, if there is a lump and it's not painful, don't disregard it. It's important to actually get it checked. But is it a cause for alarm? Like, should people feel like, oh, suddenly, oh no, I have breast cancer?
Actually, most of the cancer diagnosed is actually uncommon. You say that in a normal young woman, the causes of breast lump usually is fibroadenoma, fibrocystic disease, breast cyst. That's very common. Much more common than cancer. So if you feel a lump, don't panic about it. Go and see a doctor. Majority of them will turn out not to be cancerous.
Thank you for saying that, because I think that might have alarmed many people who are listening in. Because you know how our generation is like. I don't know, everybody immediately when they find something, they start to go on to Google, search engines, maybe even ChatGPT, and the immediate thing they might see would be, you have cancer.
Breast cancer lump actually will grow, so it's just sometimes you monitor it. So a lump that has been there for many years, many months, it doesn't grow. Sometimes it's just a normal, benign, non-cancerous.
Non-cancerous.
But still, if you feel a lump that's more than 1 centimeter, best to see a doctor.
Okay.
So usually cancer can grow, and also usually a bit more hard compared to soft. So that's how when the doctor feel it, there are a few ways that we can tell from the consistency and the area that we feel. And also we'll look at whether there's a nipple discharge. Sometimes the lump can be causing a ductal problem, and then there's a bloody discharge from the nipple.
Oh, bloody discharge. Oh, wow. So many. So we have to look out for not only lumps, but also whether it's hard, whether it's painful, whether there's bloody discharge from the nipple.
And also we look at the skin texture. Sometimes the cancer can cause a redness on the skin. So abnormal rashes on the skin of the breast also a concern as well.
Ah, I see.
And sometimes we look at the size of the cancer of the breast. Sometimes so most of the female have two uneven breasts.
Oh, okay.
So you can have
another fun fact.
Perfectly paired. Usually about 10% difference is acceptable, 5 to 10%. But you can see that obviously when you look inside the mirror, your arm's position is up. You can see one side of the breast is actually bigger than the left. All very obvious to you. And there's any changes, they say, I never noticed it before, then you best to check it as well.
I think most people will not notice it because who is going to do that?
That's why regular self-examination will tell you what is your baseline. Your baseline is important because you never checked before. So we finally, I'm not sure whether it's new or not.
Correct,
so if you start today, this is my baseline. I'm always like that. Then at least you know, next time you know, this
then we
is
can
something.
compare.
Yes, correct.
Right. I see. Okay, so just following up on the ways that we can self-diagnose, are there any ways to reduce one's breast cancer risk?
So we look at the risk factors of breast cancer. What are the major risk factors? So the highest risk factor is obesity.
Obesity.
70% of breast cancer is driven by estrogen. Estrogen is a female hormone.
Yes.
Let's say for testosterone in male that causes prostate cancer, related to prostate cancer. So the estrogen level is there, and then the receptor is turned on, so there's a higher risk. So those who have obesity, the estrogen is stored in the fat. So the fatter the person is, the more estrogen in the body.
And too much of it is not a good thing.
Stimulate the breast to undergo cancerous changes. So that's the number one cause. But besides that, obesity causes another 12 different types of cancer. From meningioma, brain tumor, from ovary cancer, gallbladder cancer, pancreas cancer. There are a lot of cancers that's caused by obesity. So obesity is very similar to smoking. We know smoking causes lung cancer. That's very common. We know that eating red meat and low fiber causes colon cancer. But obesity is the main cause of breast cancer, and we don't talk much about it.
We don't. This is the first I'm hearing of it. Obesity causes breast cancer.
And that's why obesity in the US and the UK and European countries are much higher risk of getting breast cancer because they are a lot of time more obese and overweight patients, people in the general population because of that.
Wow. So obesity is it the main cause?
It's the main cause. Then the second most common cause is actually alcohol. So a lot of younger women drink alcohol, but alcohol you drink in moderation, you'll be okay. But usually excessive drinking, the alcohol will stimulate cancerous growth. Not just about breast cancer, but also can cause throat cancer, tongue cancer. And causes liver cancer. So these are a few cancers that the alcohol can cause. Now, of course, then the hormone replacement treatment. So sometimes people after menopause, to make sure they're still young and beautiful, they go for hormone replacement. It's okay if you have pre-menopause at a younger age, but if you are 55 years old, if you do a hormone replacement treatment for another 5 to 10 years, by the time you're 65 years old, you still want to look good, right? So that one, over a time, the estrogen production will cause a higher risk of getting cancer. So we never advise hormone replacement beyond 5 years or so. Everyone will have their own risk.
Wow, so there's obesity, there's drinking alcohol, there's hormone replacement.
So there are another 2 more things.
Yes,
one is exercises. Because those who have physical activity, there's less higher risk of getting cancer. All sorts of cancer, including
so all the couch potatoes.
Smoking is linked to a lot of cancer, but smoking has a small risk only for breast cancer. But smoking usually associated with lung cancer.
I see.
So actually, a healthy lifestyle in general will reduce all sorts of cancer. So healthy lifestyle, there are 3 things I look at. One is the physical activity. That means exercises. We usually ask to exercise 150 minutes or more per week. Usually 20 to 30 minutes per day. But don't do a binge exercising, but just do gradual exercising every
like consistently every day.
Then we thought that you need to go to the gym for exercise. Actually, there's no need to go because sometimes a 60-year-old say, I cannot go to the gym to exercise, I got knee problems. Actually, when you call exercise, anything that causes your heart to be a bit more cardio. That means you do a brisk walking or you do a housework that's more rigorous.
Housework. That's helpful. That's very good. So everybody can do housework.
Because it's a housewife, right?
Yeah,
actually
correct.
you just have to make sure you mop the floor a bit more faster.
Yeah, like
Yes, correct.
clean it a bit cleaner.
Yeah. So in a way, you cardio goes up because you're using a stick to mop yourself. So actually walk a bit more. So those who actually want to save money, I would say that actually you come down one bus stop before your house.
That's a very good tip.
Then you just walk past the next bus stop. So then you force yourself to walk, right?
Correct.
And then if you're able to, your knee is still good, try to climb up the stairs.
Instead of taking the lift. That's a very good tip, yes.
As well. So these are simple things that you are doing anyway. You don't have to go to the gym. And any exercises beyond about 20 minutes a day is just enough to reduce the cancer risk. You don't have to be very long.
That doesn't sound that difficult actually.
Yes,
it's very doable for most of us.
Yeah.
Wow. So exercise, and then was there any more things we can do?
Diet and nutrition is very important because you are what you eat, right? There are a lot of
That's true.
In the Chinese, you always say that actually disaster comes from what you put in your mouth. There's a Chinese saying that this come from that. So actually, your health actually depends on what you put inside because you're feeding your body. So you must feed your body with nutrition so that your immune system will be strong enough. So I always ask the patient not to eat processed food and junk food.
I think I'm quite guilty of that. I love my chips, my fries.
So when you look at processed food, right, you
Yeah.
look at whether that is actually so over processed or not. Over processed means meat doesn't look like meat anymore because they make it into a special thing, right? And then the vegetables have lost all their enzymes because they're overcooked or changed to another substitute.
I see. What kind of examples would you share?
So if you talk about the salami, sausage,
salami,
bacon,
sausage,
these are not real meat anymore.
Wait, bacon is not real meat?
Because it's processed meat already because they have under smoking process.
Oh, I see.
They actually slice, so actually they are cooked in a way they have undergoing chemical changes. So if you eat meat, let's say a pork, beef, you just eat a pork and beef, just either fry them or you cook them in a soup and then eat it as simple things.
Keep it simple, right?
Yeah,
Don't need to
as
process
simple
it
as
too
possible,
much.
Yes. So if you eat a bit of steak, so we try not to eat too much red meat. So by the way, red meat consumption is supposed to be 500 grams a week. That is the recommendation. So 500 grams a week means two small, 250 milligram of steak, right? So 2 steak a week. That means you must have a meat-free day. If you can substitute with chicken, so meat-free is red meat. So you can substitute with chicken and fish. So you got chicken, red meat, pork or beef or lamb, then after that fish. Then you at some point you don't have to eat red meat every day.
Okay, so if we have a balance between red meat and lean meat, that is
that is
okay,
for the
right?
cholesterol part, but it's still the red meat is the red meat. Also the way how you cook it is important. Of course, the red meat that is not barbecue until there are changes, because every time you barbecue, let's say you barbecue a satay, and the fat itself has changed to a bit darker, it becomes aromatic amines, and then this burnt things actually is carcinogenic.
Oh, also all the chao da parts, if I can say that, that people actually love because it tastes so good. But so you're saying that we shouldn't eat that.
Chemical changes, So go as per nature as much as possible. Eat as simple as possible. Don't overcook your food. Don't burn your food.
Don't burn our food. Okay, that's
of course,
a very
you take
good
it
tip.
as normally you want to enjoy your food, it's okay, but you don't eat burn food every day.
Eat moderation, right? Don't eat too much.
So a lot of fruit and vegetables is very important. That one, fruit and vegetables, high fiber and good enzymes. Itself is an antioxidant. So we always say that the Mediterranean diet is the best diet in the sense that they have high antioxidant because of the salad. You see, when you talk about salad, of course we don't like to eat salad because it's not much.
I love salad actually. I love salad. Yes, that's good news for me.
A lot of times we overcook our vegetables, so all the enzymes and everything good things is all gone. So salad itself, because you eat it more raw, so you preserve all the nutrition you eat and the fiber doesn't get destroyed. So in a way, the Mediterranean diet is a good because it's just higher in fiber, fresh fibers.
Okay, so let's talk about mammograms. What can we expect if we go for a mammogram?
So mammogram is just an X-ray of the breast. So actually, the mammogram target is actually from 40 to 49 years old. Every year we do once. So
every year once?
Every year once.
Oh, okay.
From 50 to 80 years old, we do every 2 years. And the reason for 40 to 49 years old is because we found that this group of patients have a higher risk of getting a more aggressive form of cancer. So sometimes within 2 years period is too long a period because the cancer can grow within 1 year.
Within 1 year?
Yeah.
Oh my gosh.
So there's a reason why we do it every year for 40 to 50 years old. But after post-menopause, 50 years old and above, you can do it every 2 years.
Every 2 years.
So when you do the mammogram itself, you come into the center and then they'll just see an X-ray. But for the mammogram to work, they have to actually put it in between the metal plates and compress the breast. When you compress the breast, you can see the definition of the breast tissue much better. So what we're looking for is a calcification. It's actually a white dot inside, like calcium deposit.
Calcium deposits.
Inside the ductal part of the breast duct. So in the breast itself, there is a breast lobules, which actually the milk-producing gland, and then the gland will go to the duct, where is the ductal is like a tube to go to the nipple for the milk to come out.
Yes.
So majority of the cancer, actually 70% happens in the duct and 30% in the lobules. So we look at the calcification in this ductal itself, then to diagnose even a 0-stage cancer. That means it will not become invasive. So a cancer that's 2 or 3 millimeter can be diagnosed on a mammogram.
Oh, so is that so do we call that like early stage cancer?
Very early stage.
Very early stage.
Yes.
Oh, okay. So, wow.
Because if you diagnose early stage, you almost have a 98 to 100% chance of a cure.
Oh, wow, that's amazing.
And you do not need to have chemotherapy.
No chemotherapy needed.
Yeah, because it's not become invasive.
It's not invasive.
So you remove the area even before it becomes invasive, it becomes stage 1, stage 2. So you avoid that from transforming to a more aggressive
form of cancer.
So 1 in 13 women have cancer here, So every 13 women, there's 1 who get breast cancer in Singapore.
1 in 30?
That is quite high.
Oh my gosh, that is so scary.
Yes.
Wow.
So just now, if I give a talk in a room of 100, you can see that 1 in 13, at least about 8 to 9 of them will get cancer in their lifetime. That is a lifetime.
That is so scary. Like, it could be any one of us. Wow. Can I just ask, our mammograms, you mentioned that we have to, the breast has to be in between plates. Two plates.
Yes.
Is it painful?
It's painful.
Just to debunk the myths. I think people are afraid of mammograms. Oh, your wife says it's painful. Yes. Oh, I
so
see.
Usually we ask if you feel it painful, 30, you can take a Panadol tablets 30 to 60 minutes before.
Oh, before.
Just to reduce
so we like prevent the pain.
It's supposed to be a bit painful because you have to compress a bit tighter. So it will cause a bit of pain. But of course, everyone's tolerance is different. Some people will fall down and they don't cry. Some people with a little bit of,
little bit only pain. I think that's me. I'm like,
some of the breast also, make sure that you don't go during when you're having a period or 7 days during a period because your breast will be more tender. So go during after your period. On a safer period, 2 to 3 weeks after your
after
first.
The period. Oh, okay. Yeah. That's a very good tip, everybody listening in. Yeah, so we have to time it right. And we can expect a bit of
but it's very fast,
It's very fast, is it?
Yeah,
what is the process like?
Finish.
Serious?
Yeah.
Just tick tap?
Yeah, it's just gone and then they compress it straight after they go there. Hold on, press the button.
That's it?
Yes.
Oh wow. All along I thought it was a very long, scary process.
Not too long. Of course, when you go in and press the time, okay, the mammogram, it takes some time. But all in is very fast at the end.
Wow. So we can be in and out in 5 minutes?
Yeah.
Wow, okay. Actually, I think that would give some relief to a lot of us who have been wondering whether we should go for a mammogram. Like even for myself, like I also want to take better care of my health. So that really brings a lot of relief, like wow, not too painful.
The other thing that we do is ultrasound. Sometimes ultrasound can see breast cysts a bit better. So sometimes ultrasound will be add on to the mammogram, but the most important is still the mammogram. Second, the ultrasound. We ultrasound patients under 40 years old because the mammogram for very dense breast, because as we get female get older, the breast itself become more fatty. So more fatty, they can see a bit better. But if a very dense breast, so everything become white. So the calcification cannot be seen very clearly. So under 40 years old, we sometimes will use an ultrasound or an MRI scan of the breast.
Oh, MRI.
Yeah,
Okay.
show a better picture.
Wow. Okay. So there's mammogram, there's ultrasound, and MRI.
Yes.
So there are actually 3 ways to detect breast cancer.
Right.
I see. Okay. Thank you so much, Dr. Choo. Are you able to share? Does early detection save lives in your 20 over years of being in this line? How often do you see that?
So when you actually do a mammogram, you diagnose as stage 0 or stage 1. So every single stage is dropped by 10 to 15% survival. So for example, a stage 0, 98 to 100% chance you'll be cured. if you do for surgery. When it's stage 1, it becomes 85%.
Stage 1?
Yes.
85%, okay.
So that means there's still 15% of patients who will eventually develop metastatic and they will die of it. Yeah. So when you go to stage 2, it becomes 70%. Wow. It becomes stage 3, it becomes 40 to 50%.
Wow, so it continues getting lower and lower.
And it becomes stage 4, is not curable.
Oh man.
So there is a stage migration. So the earlier you detect the cancer itself, then the better stage you are at and better chance of a cure. And that's the reason why we say the early detection safe life. Late detection means you become stage 4. That's late detection. Remember there's one patient who's in the under 30 years old,
Wow, so
he
young.
got a brain tumor. So he bought a policy. The policy paid $1 million for critical illness. But because he got brain tumor, so it becomes stage 4 straight away. So at the end, when I fill in the critical illness form for him, he said, you're going to be rich. He said, Dr. Choo, you want to be rich or not? I give you the 1 million. I give you my cancer as well.
Oh!
That's why when you have cancer, money is no longer a main thing.
Correct.
I just want my life back. My life is more precious than 1 million. I do not want to claim any critical illness. So who want to buy a policy and able to claim? We all don't want to claim.
Yeah, the best thing is we don't want to claim,
It's just a safety, just in case.
Correct.
That 1 million, because he doesn't have insurance, the 1 million paid for his treatment. That is very important to him. Because of treatment, I went to his wedding.
Wow.
5 years later, I said, can I get married? I said, of course, it should be. It's a very rare case that he's cured.
Wow.
Because after 5 years, he said he considered cured. So after 5 years, he got married.
Wow, what a blessing. Yeah. Really a true blessing and a miracle that he got married after 5 years.
And also with good treatment protocol, we now have all cancers, we have a treatment protocol. We just follow the protocol because protocol is what we call evidence-based. We've done a lot of research, we've done a lot of ways that we look at that. If you follow the pathway, most likely it's going to succeed. So a lot of times I feel very sad because a lot of patients who actually been diagnosed, they go to alternative medicine.
Alternative medicine,
correct.
Like, care to share any examples?
Alternative medicine, that means I take supplement. You get a supplement, or I go for traditional methods to do that, or you try to work out their lifestyle. I say, my lifestyle is very bad. Maybe I eat more healthily, maybe I exercise, maybe the cancer will disappear on its own. Maybe I boost my own immunity by taking some drinks, some juice and all that. So, but a lot of times when the cancer has happened, that means your body has failed to kill it. So boosting your immune system actually is too late. You need to take it out, remove it, kill it, and then you actually boost
reset
again,
reset again.
So that you can stop the cancer from coming back. That should be the correct way. Breast cancer community and the support group that I formed is very important, powerful thing because they are doing things that I cannot do as a doctor. There's one cancer patient who, young family, when she was diagnosed, the husband doesn't know how to cook. And the husband go and buy hawker food for her because I don't know how to cook. Right? Then she was cancer, she having undergoing chemotherapy. There are 2 teenage children inside. Nobody knows how to cook. So they said, I can only buy hawker food for you. She threw the hawker food on the floor. I said that I eat all this, I'll die, I said, I cannot eat this, I got no appetite. So she was very sad. Then she come to me and said that, Lord, I don't know what to do. I mean, lost my... So I sent a story to the not breast cancer, another support group. I got a few support group. This support group said that it's okay. Where does she live? I said, nearby. I will cook extra portion and deliver to her. They deliver food to her. These are complete strangers,
That's so generous.
Very generous because she only needs a support for 3 months. They said, I'll go into the house, I cook extra. Then this person who actually got better underwent the treatment process, got encouraged, and now she's doing it for the rest of the people.
That is amazing. She's passing it on. Passing on this kindness.
If these people don't help me, I would not have survived. I want to do the same thing to other people because I know these people exist because I was one of them.
That is simply amazing. Wow.
It's really like social enterprise.
Yeah. So not only does it involve like the treatment, but also the after treatment care, the whole like supporting one throughout this journey. Something as simple as a meal can make such a difference over 3 months. And now she's well. And she's doing the same thing. That's simply amazing.
People want home cooked food during chemotherapy.
Yeah, correct. We want comfort food. Correct. Wow.
And they want food that been cooked by cancer survivors because they understand that you loss of taste, you understand you feel nauseous. They know what to cook for you because they have the same thing. That's why a one-to-one support from cancer survivors to cancer patients is the most effective way to help you lead through the journey because in Chinese, they say, 过来人, they have gone there and come back. So that's why I say that you need to speak to people who have undergone the same journey as you. And now, because we are so big, we can match one-to-one. That means, whatever chemotherapy you have, whatever stage you have, we can match one-to-one because we got so many people.
Wow, we have power in numbers.
Yes.
Oh my gosh.
We got patients, they say, I got stage 2, any 5 million on stage 2 one. Some have stage 1 because I'm more advanced, right? I want the stage 2. So when a stage 2 listen to a stage 3, they're very happy because the stage 3 survive, right? I'm stage 2 only, I'll be better.
Yeah. And it helps to keep their spirits up, you know. It gives them like a something to look forward to, you know, a positive kind of example to kind of calm their nerves, you know, not be too stressed out. Because I imagine it's quite stressful to like be alone in this.
So we call them a befrienders. The befrienders are sense of survival. They make friends.
Wow, befriender. So can I ask, is this part of what you are advocating for in the Breast Cancer Foundation?
We have started for many years already. Even before I joined, there is always a befrienders networking. So there's another support group that I do, which is a nose cancer support group in NUH. We managed to prove that actually the befrienders support actually can reduce the distress level of the patient, from fear, anxiety, from ability to cope with their lifestyle, and the quality of life will improve. We have proved in the clinical study actually joining a befrienders program will help you fight the cancer much better, and your process of the cancer journey will reduce your fear and anxiety.
I believe that actually. Yeah. Because the less stressed you are, I guess your body is also reacts better to the treatments, and it's also a mental thing, right?
Yes.
To go through something so so extreme. Yeah.
So I always say that never fight cancer alone. You go to a cancer battle alone, you find that I'm going to win or I'm going to die. But you go and fight with people who have come back alive, you say, I'm going to live because they are all alive.
Exactly.
And then they are able to push you. It's like how you run, you know, you run in a marathon and all that. It's the people like 4x4, people who actually what we call the partner pushing you forward.
Yes, like a pacer, right?
Pacer. That pacer is important for you to push towards the finishing line. And that's where, if you fall down, they're going to pick you up and say, don't worry, run again.
That's so beautiful.
If you fall down, if nobody says, I cannot get up, say, give me your hand, I'm going to help you out. They're going to get up and they're going to run again. And that's why this journey is very important. We have to do it as a community. There's no other way.
That's beautiful. Yeah, they say if you want to go far, go with others, right? Wow, that's amazing. That's so beautiful. Wow. So let's talk about how can our listeners here today take part and involve themselves in the Breast Cancer Foundation?
Their Breast Cancer Foundation mission, there are two. One is for advocacy, to have early detection, to fulfill the role of a screening. So the screening program in Singapore, unfortunately, only 37% of people who's eligible actually sign up for it. That means 63% of the people who's eligible, they don't go for it.
Oh my gosh.
So there are a lot of myths and a lot of fear on that. So there are multiple reasons why people don't go for screening. Because number one, they think it's not necessary. Number two, may not affect me. I got no family history. Number three, I'm too busy. Number four, I scared that I get diagnosed with cancer because of the mammogram. So there are a lot of fear that in the Western world, actually 70 to 80% goes for it.
Wow, why are we not going for it?
Half of what the normal world population for them. Because there's still, I think, a lot of taboo, there are a lot of issues around that we have to work it out. So to help Breast Cancer Foundation mission is actually just to ask your family members, friends, relatives, you're eligible, just go for it. So mammogram is not going to spread the cancer, not going to make breast become cancerous. Okay, but a bit painful, but it's okay because
it's worth it, right?
It's worth it, and compared to lose your hair when you're diagnosed and then you have chemotherapy, right? That is much more worth it, right?
Definitely, yeah.
And the other thing that the second one is that we are doing advocacy work for peer-to-peer support for that reason. So if you can volunteer in our Breast Cancer Foundation, we accept any volunteers. You got IT, you got photographer, you got anything. We also accept as volunteers because we do a lot of outings. You got people who need help with counselling and all that thing. If you have any extra skills, just contact us and see whether we can fit you inside our volunteer program itself.
I think that's so beautiful. This community, not only does it, it's not only one way, right? As you help others, you're also helping yourself and your family members, and overall the whole community benefits.
We even have high school students come and volunteer.
That's amazing. Start them young, man. Start young. Yeah. Because doesn't it inculcate a spirit of going beyond yourself? You know, I think society can feel kind of selfish. Kind of it's too like me all the time. So if you set aside some time to volunteer your spare time to those who really appreciate it, I think we would all benefit. And overall.
Recently, there's a Vietnamese patient of mine come all the way from Vietnam. She comes every month for treatment here. Then she was alone here. I said that, by the way, where do you go for lunch? I said, just simple, because They come here and then next day she go back and see. So I bring you to the Breast Cancer Foundation support group. When she came in, then she know this is my patient from Vietnam. She's alone here. Then all these 10 people go and surround you. How are you? How are
my
you?
gosh! Everyone's so friendly.
Tell you that, where do you stay hotel? Next time don't stay hotel, come to my house and stay. She was very shocked,
Wow.
These people are so nice. Come to my house and stay.
Wow, family already.
Amazing, first time meeting. These are people who are very warm, They know, they identify you as one of their fellow survivors or patients. They know you're very lonely, you're very scared. I want to make friends with you. They are very willing to make. So she was almost moved to tears,
Yeah, man. Like, doesn't it just warm your heart?
Yes.
Like, wow, there's this camaraderie, the feeling of just being one of us in the community. I think that's so beautiful. And also to anyone who's listening in, if you are considering to volunteer or maybe you want to reach out to the Breast Cancer Foundation, you can search and type in your browser bcf.org.sg, and that's where you will find all the information that we are talking about here about the Breast Cancer Foundation. Thank you so much, Dr. Choo. Just want to say a big thank you to you for sharing all these valuable insights with us. And also thank you everyone for listening in to this podcast. And if there's one thing to take away, it's that awareness and early checks really do make a difference. And you are never alone in this journey. Yeah, so thanks again for joining us, and we'll catch you in the next episode. Bye-bye.
Thank you. Bye-bye.